And head of the COVID task force for Piedmont Hospital. Good morning again.
Good morning.
Thanks
How
for being
are you?
with us.
Thank you.
Good. So let's talk about this. You know, the rules have changed so much from the time we first dealt with COVID to now. So if I'm the president and Dr. Joe Biden tests positive, what should you do after an exposure like that?
And since the public health emergency ended in May, we have gone to sort of a little bit more relaxed state here in the United States. But we see community transmissions, community transmissions really increasing across the nation. And so President Biden would actually be a first contact or primary exposure now of someone who's COVID positive. And so a primary exposure means that you have been within 6 feet of a person who's COVID positive, and you've spent at least 15 minutes within those 6 feet in a 24-hour period. So I'm assuming that he fits that criteria. It really means that he needs to mask for the next 10 days while he is indoors or indoors at any public facility.
Yeah, such smart advice. And it's so different now, like you said, more relaxed from the beginning days when we had contact tracing and the calls and making all the calls to your close contacts.
That's right.
Do you think now is the time, if you're going to be in a crowded setting with the rise in cases, with the rise in hospitalizations, should we be masking up again?
You know, look, we've got all these science tools, we've got all these public health measures. People need to make an informed decision about which tool is right for you and apply it to very specific situations. We now all have the ability to decipher that information. You should always have a mask with you. Have it handy. You may be in a situation where you need to use it. You are indoors, or maybe even you yourself are coughing and are unaware of whether or not you may be sick or contagious to others. Remember to think about what that means with hand washing and hygiene and isolation and social distancing, but also vaccinations, boosters, all of these things, Paxlovid. We've got so many tools now in our armamentarium. Make those decisions that are best for you and best for others around you as well.
So you bring up vaccinations. You know, for if you're all caught up, what's the next step with the next booster?
So September 12th is when the advisory committee for the CDC should be meeting to make a decision on these updated boosters and also giving us guidance on who should receive them and what the priority would be. After that, we expect them to be available within the week, assuming that there is approval, and we assume that they will be approved.
Dr. Morgan, I know so many people right now with COVID-19. It's kind of shocking almost how many people I know.
That's right.
What do we know about this specific strain that's going around?
So we don't have as much information as we had before the public health emergency ended, because states were required to track data, and indeed countries around the world were required to track that data and report it. Now that is not required. So what do we have? We have hospital admissions as a gauge, emergency room visits as a gauge, and deaths. And we've seen all of that uptick throughout the summer. In fact, over the last 2 months, we've seen that almost triple in cases. Now, that also then would extrapolate that community transmission must be quite high. The reason I say that is that this particular variant still continues to cause mild symptoms, and yet we see hospitalizations increase. So there would need to be a large volume of mild cases to drive up that hospitalization.
And just kind of a refresher here, if you have COVID-19 and you've tested positive, at what point should you go to the hospital? What are the symptoms you should be watching for?
So if you are having any difficulty breathing, shortness of breath, lightheadedness, anything like that, you should absolutely seek emergency medical care. We do see people in the hospital, so don't be lulled into a false sense of security that, oh, this is mild and it is survivable. We do see hospitalizations, emergency room visits, and deaths increasing even with this mild virus. So always exercise caution and make certain that you're taking care of yourself and taking care of others.
Stay healthy and stay alert. Healthy Morning contributor Dr. Jane Morgan, thanks so much
Thank you
for sharing your expertise on this with us this morning.